What's up everybody, Ben Batman here with Batman Fitness and Strength, and today we'll be doing my second research review video. I'm going full nerd on you, button up, glasses, all that jazz. I'm excited to talk about this research report. It's going to be broken down into 4 different parts because it's so dang long. So this is on exercise and its relation to anxiety, stress, and depression and other emotional disorders. So the title of this article is The Effects of Physical Exercise on Anxiety, Depression, and Sensitivity to Stress, a Unifying Theory. So this is going over many research articles, meta-analyses, all that put into one research report. It's been cited by 213 other research articles, and it came out in 2001. So since it's been cited by 213 other research articles, it has pretty good merit. So far, the possible psychological benefits have been neglected due to a formal exercise program. So most studies are doing regimented, formal exercise programs, very structured, not incidental exercise, like playing soccer or frisbee recreationally, formal programs. And with these studies, the main measure of fitness has been aerobic exercise. So aerobic exercise is the capacity for your body to do aerobic work, normally measured through VO2 max, which is essentially the maximum amount of oxygen that you can be used during intense exercise. Now obviously aerobic exercise and VO2 max are not the only measures of fitness. I'm sure you can think of many more. So although discrepant results exist, the overwhelming evidence confirms mood improvement related to exercise and depression, stress, and all that. In sedentary individuals, generally sedentary individuals will not volunteer for exercise studies. Thus, we have fewer studies on sedentary people. Sedentary just means you sit most of the day. You're not up moving around and all that. And then mood improvement is confined to those who are unhappy initially. So you gotta be unhappy to get that mood improvement with exercise. In these studies, we see that exercise that is more intense than the participant's habitual level is less likely to improve mood and indeed is liable to worsen it. So you can't throw someone into something super intense if they don't have prior experience with exercise at that intensity. Exercise at competitive levels can worsen mood in habitual exercisers. So even if you exercise regularly, if you add a competitive component to it, you might worsen the person's mood. And then strenuous exercise in people who are not selected for having intense exercise habits has commonly, although not always, been unpleasant. So that is, it increased negative mood or decreased positive mood. Overall, it has been shown that mood has improved after strenuous exercise selectively in fitter and more active subjects. And then furthermore, more confidence in their exercise capacity in turn could reflect greater experience of exercise. And people who are already fit, strenuous exercise increases mood, and then people who are gaining confidence in their ability to exercise might also affect their increased mood. Now, the unpleasant effects of exercise are likely to be underestimated because someone who doesn't like to exercise will probably not volunteer for a study that requires exercise, although of course, you have your exceptions. Nevertheless, most available data are accounted for by the generalization that aerobic exercise is a positive experience. That's good. When performed at the individual's habitual level, so their regular fitness level. And that although strenuous exercise improves mood in regular exercisers, it can decrease mood in non-exercisers. So it's not as cut and dry as it seems. The emotional effects of exercise depend on the environmental cues, the physical space that they're in, and then social cues, so the people that they're with. There's a reason that CrossFit has a cult-like following, okay? Everyone's in one room, they're going at it together. People enjoy that, people like that. And then obviously having a good space to work out in. Maybe someone hates working out at their home, so they go to a gym and vice versa. People need to like the space that they're working out in to enjoy it. All of what I just said can be boiled down to essentially don't throw someone head first into strenuous exercise. And if you are a trainer or group exercise instructor, you got to take into account the client's or the group's exercise experience. With the trainer, it's easier because you have a relationship with the client. You know the previous exercise experience, you know if they have any health conditions or anything like that, and you can program accordingly. Now, for a group exercise instructor, you don't know that. You don't know your class intimately like you do in a trainer-client relationship. So that requires you to have variations of exercises. So there's lots of studies that go over exercise and depression, anxiety, stress. I'm not going to go through all of them, but for the most part, exercise is shown to be positive or show a positive mood increase, alleviate stress and all that with most of these studies. So, however, most of them did not have controls, so you have to take that into account as well. A control group is a group that is not receiving a treatment. So in this case, the control group would not be exercising, or maybe they're on regular antidepressants. So this could just mean that the enduring depression caused a restriction in activity. So depression made them not exercise. So it could just be that. So you have to look at all this objectively in an unbiased manner. Okay, so moving on to exercise as an intervention for depression. This is the more exciting part. So we said that some experimental studies have shown that a formal exercise program will show an increased positive mood, improved mood. However, these studies are limited given the inherently difficult nature of clinically depressed people to exercise. If you're clinically depressed, you're probably not going to be exercising. So even if exercise improves mood and helps alleviate depression, there is a problem of getting that person to actually exercise. Exercise may help, but if that person is not even exercising, not motivated, then exercise is not going to help them, obviously. And this was something I hadn't thought of before. Remember when I said in the beginning that I was just thinking, throw exercise at it, it'll fix it. So this is one of those instances where this is not the case. Clinically depressed people are probably not going to want to exercise. It's just not the case. And now you might be asking, okay, how are all these studies on depression being done if people who are clinically depressed don't want to exercise? Well, here's the thing. Many of these studies use subclinically depressed people. So they don't have all the symptoms of major depressive disorder. So some of these studies could be vulnerable to the floor effect. The people are not sufficiently depressed to show increased mood. So to be clinically depressed, you have to show feelings of sadness or irritable mood, which is dysphoria, or decreased interest in pleasure, anhedonia. So one of those two, decreased interest in pleasure or an irritable mood. And you also must show one of these two symptoms, which are decreased activity or fatigue. If you are always fatigued or you're naturally having decreased activity because of depression, you're probably not going to be exercising, okay? So it remains for clinical researchers to show that exercise participation is a treatment for severe depression, rather than evidence that it has been treated. So we have to show that exercise can be a good treatment for depression, not the evidence that depression has been treated. So where does all this leave us based on this research report? So we know we can't throw exercise at a clinically depressed person. They're experiencing dysphoria, fatigue, decreased pleasure in life, all those things. They're not going to want to exercise. So we can show exercise or have exercise as the evidence that they're being treated, then add exercise in, whether a formal or informal way, and that will help deal with the depression, treat that depression. Or clinical researchers can find ways to bring in exercise during the treatment of depression. Find ways to motivate the depressed person to exercise. So it's a big area of research, I think, that researchers should focus on. All right, everyone, that was part 1 of this research report. We got 2 or 3 more parts coming. I hope you enjoyed this. If you have any questions, put it in the comments. If you enjoyed the video, give me a like and a subscribe. Have a great day and stay strong.